just feel free to interrupt me, and so you won't lose your thought or your question at all. So again, everyone, thank you for your patience as we got all the calls and the audio and visual stuff taken care of. This is the CETPA Regional Evaluation Training. My name is Sinead Bryan. I am the Senior Program Evaluator at Evaluation Group, and I'm also the Evaluation Team Lead. You just heard Trellis. Trellis is the Program Evaluator also for CETPA, and she's our Senior Research Associate. So she'll be working hands-on with Diana and the program coordinators and making sure that the data is collected on time and making sure that we adhere to the evaluation plans. And me as the lead evaluator, I will be compiling the data, interacting with the state and the state regional evaluators, and making sure that CETPA is compliant with the reporting and everything that they need. So those are our roles. So we could go ahead and get started. Any questions so far?
No, not so far.
All right. So the outline of today's presentation, what we're going to do is basically give you an overview of what was in each of your region's evaluation plans. We pulled out common themes and common evaluation methodologies that we'll be using for your programs, so that way it could speak to all the regions at one time, except for Region 5, because Region 5 has a very unique environmental strategy that the other regions aren't doing. So we'll talk about that one at the very last one, and it won't take up too much time. So the outline of this training, we're going to start off with the overview of those evaluation plans and why we had to write them. Then we're going to talk about the overall evaluation design and approach, how we plan on evaluating each of the region's programmatic activities. And then we're going to go by data collection, which is the key thing. I know Alejandro is interested in this part, about when do you collect information, what tools do you use, and especially right before you begin implementing your strategies, which I know some are in the planning phases, some have already started. So we're going to go through each data collection tool, and I'm pretty sure this is the area where a lot of questions will happen. The second to last point that we'll discuss has to do with the coalition functioning and the community mobilization. And lastly, we're going to talk about communicating the evaluation findings and how we plan on reporting them out. So basically, the state requires that each region, comes up with an evaluation plan. I know you guys had to do a lot of work. You had to do the needs assessment, the strategic plan, the implementation plan, and evaluation plan is one of those that every region needed to submit. And we were happy to work with CETPA, Dr. Mancini, and Diana in helping you guys develop the evaluation plans for each region. So basically, the plan will describe how we, your local evaluators, will monitor and evaluate your program. That's number one. And two, it also describes how CETPA and other stakeholders intend to use the evaluation findings to make program improvements and also decision making, like which programs are working well, which ones are great return on investment based on energy, money, funding, etc. So the results from this plan will it would accurately describe your program, and it would link your actual program activities to the outcomes. How did this program change people? How did this program change the local environment or the local community and neighborhood? It would also describe how the program was implemented. I know that you guys have to go back and forth with the state about the strategies that you plan on implementing. And some of you guys had to choose like evidence-based strategies to implement in your regions. So what number 2 is discussing here about the results of the plans is it describes how the program was implemented. Was it implemented with fidelity, or did you have to make adjustments to fit to your population? Given that you guys were working with the Hispanic population, I know that you guys had to do a lot of changes, cultural adjustments maybe to how the program was supposed to be implemented originally. And lastly, it will provide a rationale for your program and its impact on the community. So basically, at the end of the day, every stakeholder, every executive wants to know what was the bang for the buck. was this program worth it? Was sticker shock a good way to change people's behavior? So that's what the findings from the evaluation plan will communicate. Any questions?
No.
No.
All right. Sounds good. So the overview of the evaluation plan again, these are the steps that we have taken. And it's the first three is what we've completed so far. We spoke with Dr. Mancini, Diana. We drafted a plan, had you guys review it. We described your program based on what you guys mentioned in your strategic plans and your implementation plans. And then we focused the evaluation design by drafting a detailed evaluation plan for each region. So the next step, the one highlighted in green going around in the circle, is gathering credible evidence, which we will be talking about now. This is how you collect the data using the data collection tools, the surveys, etc., interviews. Justify conclusions, that's where my team comes in, and we do the analysis of all the surveys, all the interviews, and we compile it into the bottom line statements. And then we share this information with stakeholders like yourselves, Dr. Mancini, the state, Diana, and then again we engage stakeholders and we do it all over again. So it's a very, it's a circular process, but it works, and this is the model that a lot of people use to show the merit, worth, and value of their program.
Okay.
All right. So let's get down to the nitty-gritty as we move forward. So this is an overview of what all the regions are doing. I'm not sure if you guys, I included this in each of your evaluation plans on purpose because I wanted you guys to know what the other regions are doing in terms of their environmental strategies and their individual strategies. So that way, if you're doing, let's say, like a strengthening family program, I wanted you to know that regions 6, 1, and 5 are doing the same program. So maybe you guys could talk with one another, share ideas, and communicate in ways on how to improve your program. Like somebody could say, hey, Alejandro, I'm having this problem with my strengthening family program. Did you? How did you resolve it? So I'm hoping that you guys could communicate among each other and help troubleshoot any issues that you have when implementing your programs. Mm-hmm. So overall, each region, you have to do 1 individual strategy and 2 environmental strategies. And this is it broken down. And again, this is like on the 3rd or 4th page of each of your evaluation plans. So what we did for consistency, especially when we do the final reports for Diana and Dr. Mancini to review, we had each region have the same evaluation questions. Since your strategies pretty much overlapped, we didn't want one region to be completely far off in terms of what we're looking at. So we're looking at the same thing. We're trying to get the same measures across all the regions. So we have 4 evaluation questions, 4 things that we want to know at the end of the year. And 3 are process evaluation questions, and 1 is the outcome. Process evaluation questions are kind of like, how was it describes more so of how the program was implemented. So the first evaluation question is, to what extent has each strategy been implemented as expected? So basically, as you wrote in your strategic plans and your implementation plans, did you do what you said you were going to do? Then we want to know, what are the strengths and weaknesses of each strategy, and how can they be improved? That's pretty self-explanatory. And the last one, which is one of my favorite ones, is to what extent did the community readiness change in comparison to the baseline? So as part of your needs assessment, you guys had to interview key community members and ask them about the issues that's going on with underage drinking in the community. And then you have to see, like, what resources are out there, what do they know, is there leadership out there, what is the community's readiness or community's level of change. So this is a good measure that the state is definitely interested in, and it just basically comes from what people know in the environment. And the last question we have is an outcome evaluation question, and it's, to what extent did the strategies achieve its intended outcomes? When we look at that outcome evaluation question, we're more so interested in, were you able to make a shift in the measures that link to your intervening and your contributing factors. Your intervening variables, and your contributing factors. So in other words, by implementing the Strengthening Families program, were you able to change attitudes, knowledge, and behavior of the participants in regards to underage drinking? Any questions so far?
None so far.
Okay. So there's a few ways that we plan on answering all these questions. And what we're doing is a mixed method approach, which means we're going to use both quantitative data and qualitative data to answer these questions. So when we talk about quantitative data, we're mainly looking at those surveys, the numbers, the hard facts. And we're going to see if after 1 year implementing these strategies, were you able to shift and move the numbers, and were there a significant change? But also numbers don't tell the whole story. So we're also going to be conducting interviews, such as like with the community readiness scores. And if the funding and the time allows, we would like to conduct focus groups with each of those individual strategies that you have. So for instance, with the Strengthening Family program, at the end of the program, we would like to take a small subset of parents and youth and to ask them questions about their experience in the program and trying to get some more meaning behind just the numbers and the surveys that the states want. And those interviews are really key, and they could definitely add to the success and tell the complete story of what the program was geared to do. So we're hoping that we're able to do that, but we know that it depends. We know it's hard even recruiting people to get involved in the program. So to ask them to stay back for a focus group, we understand that could be a challenge. But if it's possible, that's something that we want to look at doing. Other data that is considered qualitative would be document reviews, such as, I have some forms here that we're going to go over that each program coordinator is responsible in completing, and that would help us know, since we're not with you every single day, those monthly reports or so would definitely help us figure out how your program is progressing.
I have a question.
Sure.
So you're interested in receiving the activity that's going on each of the regions in regards to the strategies. That's what you're saying? That we would have to share that with you? I have no problem on doing that.
No, yeah. Because what that would do, to know the activities going on, it would just help us at the end of the day capture, how can I say, we do need the information for the final report. Like, for instance, if you're developing flyers and you're disseminating those flyers at health events, or you're giving a bulk of them to a partner clinic or things like that, we need to know how many of those flyers are you sharing with those key partners. And what that lets us know from the evaluation side is that if you printed out, let's say, 10,000 surveys, that you're sharing it equally and appropriately among your partners, and it's not that you had it printed and you gave it all to one partner.
Okay.
So it's like those, and those things will be in the data tools that we will go over in a few.
But you still need that input from me, right?
I'm sorry, say that again, Diana?
Do you still need that input from me on a monthly basis, right? What's going on in regards to the different strategies? The activities?
Yes, I do. And we could, Diana, me, you, and Trellis, we could talk about what's the best way we could get this information from the program coordinators. I don't want to overwhelm them, but one thing I'm thinking about is developing a survey where you guys could just input, your monthly or bi-monthly, we could do it every other month, progress on how are you disseminating information, how many stickers have you disseminated. It would be probably the easiest way to collect that information. Because, CETPA is unique in that you have 5 regions under one agency, whereas the other ones we just worked directly with the agency is the only implementer. So, Diana, you and I, we could talk about that. What's the best way to collect this information? Because I don't want to overwhelm your staff at all.
They would appreciate that.
Ms. Bryan?
This is Trellis. Yes, we will definitely work, and all of the region coordinators and Diana will definitely work to streamline that, because we're not trying to make you do duplicate work or anything extra. So maybe we can schedule. I'll make a note right now to schedule maybe a separate quick email or conference call of how we can kind of start the process. So don't worry about anything.
Ms. Bryan?
I was going to say that that they do NPRs, which is a monthly progress report every month, and there's a tab, it's an Excel table, and there's a tab that says specifically what were their activities, and from there I would just extract and then make one for you guys, and that's why I want to take this opportunity to stress the importance that each project coordinator be very specific, be very, like if you give away flyers, you have to tell me, like you let's say gave 50 flyers. Just don't write shared shared flyers. You have to say how many. Like for example, if you have an event or you share something with a coalition, how many people were there and how many people you gave a handout, or if you have a standing banner in a meeting in a public place like in a school or in a community place, how many people have seen that message, that banner or something. It has to be very specific, because that's the only way we have to put everything into perspective and using numbers, not generally.
I have a question. Yeah. Hi,
sure.
This is Gila, Region 6. We have a health clinic, and what kind of numbers? Do you need numbers just from the families that will be able to participating on SFP, or in general the community?
The numbers, it depends on how you're working with that clinic. So from what I understand, you do have your Strengthening Families program. The numbers that would matter to me are the number of participants in that program. That's one. And I will go through and let you know how we're going to use the community survey to measure their change in attitudes and stuff. But if you're doing an environmental strategy, like if you're at the clinic and you have a poster that's displayed in the waiting room, or if you have flyers or pledge cards that are being shared there in the waiting room, that's the type of information that we would need about the foot traffic in a week, about how many people are sitting in that waiting room and are reading that flyer.
Okay.
What that does for us, it let us know that what is the impact of that flyer, what is the reach that poster is, how many people is that poster reaching? Because at the end of the day, when we report it, the state doesn't want to know that, oh, you created a beautiful poster. They want to know how many people had the opportunity to read that poster and have a knowledge shift, even if it was temporary, but just how many people were exposed to that message.
Okay, perfect. Thank you.
Because what we're trying to justify is the merit, the worth, and the value of creating that poster. And so if we're not able to show the numbers or the impact of what that poster was able to do, they're not going to fund like information dissemination like that anymore. So it's like we're really trying to justify, and what this encourages you guys to do as the program coordinators is to really think about how you're sharing the information and to whom you're sharing the information to.
Perfect. Thank you.
Any other questions?
So I assume that information should be shared at the NPR. Like, for example, I know that at Lila, they have a standing banner, and they receive people, large quantities of people, like 3 days a week. And it's a big thing there, standing with a message for, alcohol prevention that's regarding to our strategy. And that would be a good thing to put that in the activities or in the awareness tab, or have it written in somewhere else. But we need to start showing the state that we are exposing people to our prevention message in numbers.
But we have to be careful that I'm sorry. We have to be careful that this is what I'm seeing. Like everything that we have to report has to be according with the strategies. Because something that Nikia told us in the providers meeting is that we are not doing awareness campaign anymore. And we are not doing Great Ribbon Week anymore. All the things that we are doing right now are part of the strategies. So if we have a flyer or a banner or something like that, we can say, yes, we showed this flyer or we have this poster over there, like a support of the strategy that we are doing in the schools, for example. Something, you know.
And specify for which strategy.
Yeah, specify for which strategy.
Absolutely. Okay. So moving on, we are now going to talk about specifically how we're going to collect data and information for your individual strategies. And again, the little table to the left is showing you which regions are implementing which programs. So the Strengthening Families program is the most common one between regions 3, 6, and 5. But the same process will apply to Protecting You, Protecting Me, and Prime for Life. So everyone here, I'm pretty sure, already knows what individual strategies are. You know, you're just specifically looking at a group of people that are participating in a program, and you're able to track those individuals. So this, honestly, is my team's one of our favorite programs to evaluate, because we could show direct attribution and contribution to change in knowledge, attitudes, and behaviors. Because we already know that this is our subset, our cohort, this is our group that's participating in this program, and we're able to monitor them throughout the whole entire session. So here goes like the infamous survey that I'm sure everybody loves. Last year they called this the NOM, the National Outcome Measure Survey. This year they're calling it the Community Survey. So basically, this is the 21-question survey. We do have this now in Spanish and in English. I'm not sure if they had it in Spanish when you guys did your needs assessment. Yeah, I think they did. They did. And what here? Like, I know that a lot of program coordinators may have struggled with this tool, especially when you look at the questions and the measures. You may be wondering, man, these questions don't really link to what my program is doing. Like, they approved my strategy, but these questions aren't really getting to it. Unfortunately, this is still the tool that we have to use to measure individual strategies, because this is what the state is interested in. What we could do is that, based on your program, we could only look at selected questions that directly apply to your program and try to move the needle in those. Like, for instance, when you're talking about strengthening the family programs and you want parents to talk to their children more about alcohol, we could follow that question item, and that could be one of, you know, the contribution. That would be the question item that we're trying to move based on your program. So we could look at that. If you're interested in adding more questions to the survey, our evaluation team can do that. I know a lot of you may be hesitant because you're saying this survey is already long and you don't want to add more questions to it. So I worked back and forth with the states for the past 2 years trying to get this question modified or the survey modified, and it hasn't been helpful, I'll be honest, especially when we are dealing with the Hispanic Latino population. I understand some questions could be a little bit too forward, and it's not necessarily like culturally sensitive. I brought that up to them last year, and yeah, this is still what we have. So any questions about the survey?
Well, I do have a question, but I don't know if I can share a little bit the experience I have right now with the Strengthening Family programs. I don't want to have more time to your agenda, Shanae, I'm sorry. But I just want to share a little bit what the situation that we have right now in the schools. Because unfortunately, the survey, like you say, is really hard for the students to understand, even if they are in middle school. The other situation is that conduct the survey add a lot of time to the schedule that we already have in the schools. And another thing, another problem, another issue that we had that our programs start in the middle of this madness with the weather that we have here in Atlanta. Mm-hmm. So the first class that we have in each school, at the beginning we have half of the parents, or all the parents, or they came late, or something like that. So it was really hard for us, and we had like almost 30 minutes to each class, and it was hard. Now the other situation that we are looking for what is going to happen in the last session, especially with the Strengthened Family Program, is that this survey asks questions about, for example, if you have, you say during the past 3 months, have you talked with at least one of your parents about the dangers of alcohol? You know, the problem is that the last session is the session that where we are going to talk about alcohol. So, of course, the answer is going to say no, the same as the pretest. And I explained this to the state, I explained this to Nikia, but we don't have option right now. The only option that we are looking right now is to add another class, but for that we need to look for the sponsors to pay for the food and for the other expenses that we have. And talk with the schools and ask them if they are open to give us another day to work with the parents, with the higher risk that some parents, they won't come to the class. Because at the beginning we say we are going to have 6 classes, and now we are going to tell them, you know, we need you 1 more week. And that is going to be I think that we have a risk that we won't have all the parents that we are going to need. But if I can do the post-test, the same class that we are going to talk about alcohol, at the end the evaluation will say that the program didn't work. You know what I'm saying?
Right. Yeah, I do. I remember.
So that is something that we have to have in mind, and of course we can report that in the plan in the final report.
Of course.
Because the truth is that the state, I think that they didn't think in that when they say everybody needs to add these questions to your strategic plan, to your individual strategy, I'm sorry. They
right.
just say you have to do it, but they don't know, I mean, all the problems and all the curriculum, they don't know the curriculum. It's really hard. So I'm afraid that we won't have a great report or great numbers at the end. That is something that that we are worried about it. Also, I know that you asked us to have a survey with parents as well. And the truth is that a lot of parents that we are working right now, they don't know to read or write in Spanish, even in Spanish. Mm-hmm. So for some of them, it was really hard to answer the questions, or they decide to don't do it. And we have to respect that. But it's something that we need to. That is something that we need to, to as well to specify in the report that it was really hard. And for example, in one school, like I said before, we have several problems with the snow. We canceled the class 3 times. The first class we have just 3 parents, for example, 3 parents, and we started the class late. It was really hard. It was really hard to work with them. So I just want to share with you this and to keep in mind all this stuff just for the moment that we are going to write the report.
Absolutely. And Alejandro, I thank you for sharing that with me, because this is definitely, especially since you're Region 3, you were one of the first to implement that individual strategy. It is my goal to do an assessment of that strategy and share these findings with the state. My idea is that if they physically see what the possible reporting for all regions would look like, if they don't edit the surveys or make some changes in how, you know, they're advising us to move forward with the evaluation, I just want them to see what a preliminary analysis of your program would look like before the other regions get on board. So I hate to say, Alejandro, but you're like our guinea pig in how we're going to move forward for the other regions. That's my goal, because I've been having the same talk with the state for a while myself, Tara and I and Trellis. So yeah, I'm hoping that they could see, you know, the readability issues, the cultural issue, how these questions are coming across to parents. And honestly, if you guys are reading these questions to the parents, of course they're going to answer the correct answer instead of what it is. No one wants to get in trouble for some responses that they may have. So these are concerns that I do want to bring it up. But I also want to do it in a way that they continue to support CETPA and their efforts. I don't want them to think that it's too difficult for to implement programs in a Hispanic Latino region, because it wouldn't work. You know, I want to position it in such a way that it could work if we make these little adjustments. So yeah, Alejandro, I'll be using Region 3 as a way to talk to Nakia and Yvonne one-on-one, so that way we could get those changes made before the other regions have to follow suit.
Thank you.
I would like to say something, actually adding to Alejandro's comment, if it's possible, please. This is Region 5.
Yeah, sure.
Actually, I did start implementation survey, and I see many problems myself. And I want to start from the beginning. In my personal opinion, we do need more people working with us. Second, I do believe that we do need more money. Third, I will say that we need some kind of understanding agreement between our stakeholders in region, in this case, Region 5, because when we arrive to the place, even though I arrived 2 hours prior to the event, we have to clean the place, so that took 1 hour from my time. So we have to organize, clean, and everything, because the place was a mess. Something else, then the Latin community and our culture, most or less, we almost all the time late. So thanks to that, my parents, they came late. It was 6 o'clock. I was going to do implementation between 6 and 8. 6 p.m. and was nobody, not even one person. So the people started coming about 6:30. Therefore, we didn't finish until 11 p.m. Now, my surveys, they were in English. We have to use Mitzi, who is helping Shadow, and we have to use also Shadow's daughter, who is bilingual as well, and they have to read question by question. And another situation was then my surveys, the way I print this, because I request the surveys like for 2 weeks in advance and I didn't get anything. I went and print the surveys from the plan, the one I received by email. And the questions, they are not even with my glasses. Nobody was able to read or understand all the questions because they are so tiny and teeny. I mean, the writing is so, some of the questions nobody was able to read. We couldn't see it.
So we face many issues. So my suggestion is that before doing implementation, we should have a previous meeting with you. We should have all the papers in our hands. We should read the questions to us. We should have everything in Spanish. And thanks to God, I'm ending with a really positive parents. Everybody was so glad for the program. They believe that that's the need for my community in Region 5. Everybody came to me and they actually gave me their hands to say thank you, because this is what we need. So I was more than pleased. Nobody complained about the time. But I'm worried because I feel I was overwhelmed. And I try to follow the rules. I try to follow everything. And we try not to omit anything, but time was killing us. So that's why we went over the limits. Thank you.
Okay, I want to interrupt. I'm sorry that I interrupt. How can I say this? What I want to say is that I really appreciate all the work you're doing in Region 5 because it's new families that they haven't been exposed to these kinds of programs, that they have issues with timing. But I assure you it's going to be fine because the response you received from them that you were telling me is very positive. We have to stick to the time frame, and obviously the first session is always longer because we have to do the pre-test. The situation is that we didn't receive the feedback from the state with any kind of survey specifically to your region. We only got it for Region 3. I did speak with the RPS and told her that we were going to start even if we didn't have that because we couldn't wait and keep waiting because we have to do it in your region 2 cycles. So that means that we just had to start without the instrument. And I can't control, and you can't control that when you get to a place it's dirty. That part we can't do much about it. But we want to keep the people during just that time and then let them go so they won't be overwhelmed with time. And we have a suggestion. Hold on.
Something that I learned from this process is that in the next 2 cycles that I'm gonna do, I'm gonna have like an orientation meeting before we start the program, before the first class, and I'm gonna try to conduct the pre-test during the orientation, that meeting, the orientation meeting. So in that way, because our orientation meeting could be like an hour or less than that. We just want to explain the families, a brief description of the program, and fill all the applications if somebody needs help, something like that. And at the end, I would like to conduct the pre-test in that case. For the next session or the first session, the parents that attend the orientation meeting will be in that session. So the pre-test is going to work. And if we have different parents or more parents, at least we just need to separate them, and they're going to be just a couple, not the whole group. So that is something that maybe could work in your region as well. I'm going to do it in my region. The next cycles I'm going to conduct. And in my case, I'm going to try to, like I told before, add another session, and just for the graduation ceremony and for the post-test.
The post-test is very super important. So one thing that you can do is add another session, if possible, only if it's possible. And because we really want to have this, that's what really speaks of our effectiveness. So, and if you want and need a separate conference call with Chene, we can arrange that so that you be more, and with more knowledge and all about that. but we want to keep on going with the agenda.
Okay.
Okay.
Thank you, Diana. But in terms of, I like Alejandro's idea, and that's exactly why I wanted each region to know what the other regions are doing, so that way we can learn from one another and improve our programs as we go along. So I think the orientation idea, if it's possible, is a great idea.
Thank you.
Okay, no problem. But I will continue, like I said, Region 3 is my guinea pig. I will continue to see if I could improve those surveys over time. It's been a battle for me since I started working with CETPA, but I will continue the fight. Okay, so the technique that we're going to use with those community surveys, we're going to do a pre-post test. I'm pretty sure most of you guys are familiar with that. You want to see, as a group, how does the group feel about underage drinking before the program, and after the program, has their attitude and behavior knowledge changed? So the example that I used here was that, let's suppose that you had 14 individuals participating in your Strengthening Family program. And before the program, 5 out of 14 participants felt that it was easy or very easy to get alcohol if they wanted. After the program, now 3 out of 14 participants felt like it was easy or very easy to get alcohol if they wanted. So in your book, you're going to say this is great because there's 2 less people that find it easy to get alcohol. In the past, when I was working with this survey, these results like this didn't prove to be significant. And the change between the pretest and the post-test, for various reasons, as you guys mentioned, the difficulties in administering the survey and people understanding the survey, it didn't show, it showed results in the post-test, but it wasn't, I guess, significant or meaningful. I felt like maybe there's more to it that wasn't being captured. So this year, what our evaluation team is proposing to do, and we did get the approval of the state, and again, Region 3 is our guinea pig with this, we decided to do pre-post test with matching. So with the example that I gave before, when we say that there are 2 less people that found it easy or very easy to get alcohol, sometimes with matching, or without matching, you assume that it was the 5 that found it easy, but 2 less changed their mind at the end of the program. But that's not necessarily the case. When we do a matching, we could actually find that maybe all of those prior to the program that found it easy now find it very hard to get alcohol. And maybe there were 3 in the program that found it hard, they now find it easy. So what we're trying to do with this matching is to track each individual's change in knowledge, behavior, and attitudes, rather than looking at the group. So for instance, I do want the Strengthening Family program to get credit for this change of people who found it easy that now found it difficult. But if there were adverse or negative effects such as this could also be documented as well. Does matching make sense?
Mm-hmm.
Definitely.
Awesome. So in our way, this is Eval's group's way of trying to get more meaning to the data, given that you guys have so much difficulties already. We're just trying to fish for like that positive end statement that attributes to your success and positive outcomes. So Alejandro and I, this is his attendance sheet here, and this is how matching works. Each individual, when they sign up for your class, and you could work with me, email me, and we could create a sheet like this for you too. Each individual gets a code here. So this code 1 shows that this is the program year 1. This is Alejandro's 2nd session, meaning this is his 2nd school that he's implementing this program at. And this is the student's ID, 01, and it goes all the way down, I believe, to 99, even though we're only expecting like 14 participants at a time, right?
Mm-hmm.
So then you write the student's last name and the first name. This code right here is what goes on the survey right here, on the front page of the survey where it says code. That way I could keep track of this individual without knowing their name or their identity. But I can, but it gives me the opportunity to hide it.
Mm-hmm.
So that's the code. But what's also cool about having a code and attaching an attendance sheet to it is that I could attribute the participation, their attendance, throughout the 6-week program to whether or not their attitude has changed. So maybe these 3 individuals that once found it hard to get alcohol and now find it easy, maybe they only attended 1 program. Whereas these people who all had a positive change, maybe they attended all 6 programs. What this does for you at the end of the day, it gives you an appropriate number. It could give you an appropriate number of programs you could implement in year 2. Maybe you don't have to implement all 6 sessions. Maybe you could do 3 and still end up with positive change. Does that make sense?
Mm-hmm.
Any questions?
I remember that when we talk about the sessions and this sheet, the second column would say session number. That is the number of the school or the cycle that you are conducted. Is that right?
Yes, that's correct.
Okay, perfect. So, for example, we have a number for each school. Sequoia could be 1, in my case, or Robridge could be 2, and that's it. Just to clarify.
Yep.
Now,
correct.
I have to be honest with you, Shanae. I did this just with the students, not with the parents.
Oh, okay. That's fine, Alejandro. I mean, what we're trying to do is...
Because I remember that was, well, when we received the sheets, we just received it for students, not for parents. So I'm sorry if I did something wrong.
That's okay. And again, like I said, Alejandro, you're our guinea pig. So we'll see how it will play out and if this is something feasible for the program coordinators to do. Do the other regions think this is okay? Like this is something that they could do? Any feedback from the other regions?
I want to say this in Region 5. I love it because I believe it's the easy way to see actually in reality and to document the changes. I really like it. I think it's really smart.
Okay.
My personal opinion.
I don't know. Aquí va por ejemplo, en caso de...
I know this may require a little bit more record keeping, so the idea of this template here, and each region will have their own, but the idea of this template is so it can help you better track your students and their ID and their codes when you give them their surveys.
Okay. Ms. Bryan, this is Region 6, Gila. When would you be able to give us, can we print the ones that we have gotten? I don't see the pre-test, this matching. When would it be available?
So this is what is the process that the state has put in place. A few weeks before your program is your individual program is supposed to start, you were supposed to email either me or Diana about it, and we will request the surveys and have it mailed to you with the directions of the matching. What I wanted to do, because I know with the weather and everything, a lot of plans and initial start dates have changed. It is my goal by the end of this week
I cannot hear you well.
at least 50
I cannot hear you well. I'm sorry.
Yeah, I can't hear you well either.
I'm sorry. Is that better?
Yes.
Okay. I'll start all over again.
I heard you that about the 2 weeks that I have to actually send the email and requesting it.
Right. Okay. So 2 weeks prior to your program begins, you're supposed to email Diana or I, or Diana first. You definitely copy Diana that your program is about to start and that you would like to request surveys. And then Diana and I will request the surveys from the state and have it directly mailed to you. Those surveys will be, you give us an estimate of how many adults and youth that you plans on, starting the attendee index.
Okay,
Afterwards,
perfect.
they will have instructions on how to do the matching, and you and I will do a call just to make sure that you're comfortable with the matching and completing this sheet right here. What I plan to do, though, because I know that everyone's start dates has changed from the implementation plans that I reviewed like months ago, I want to have each region have their pre-test surveys just already there, and they could implement it whenever they're ready. So it is my goal, and me and Trellis will facilitate that by the end of next week, we hope that each region will have at least maybe 50 Spanish, 50 English surveys, pre-test surveys waiting, pre-test and post-test surveys there waiting, so you guys can implement as your program comes. So this will not be a delay for any more strategies.
Perfect. Thank you.
This is Elliot from Region 4. So
Hi,
the surveys for the teens, Deanna, you sent me an email with surveys for the adults that I'm going to be doing, and I got that one. But the surveys for the teens, we're going to get those by mail, if I understand right?
Yeah, that is correct.
Okay, because I had the date set for March 9th for the start of my Time for Life workshops.
So, Elliot, what we could do for you, I have the teens electronically. I may have to print that out, email it to you, and have you print it out so you could implement it.
Okay.
The idea behind it is that I didn't want you guys to have to go through printing and copying costs when it's the state when they could do it.
Okay.
So, but we may have to do that just because yours is starting March 9th, you say?
March 9th. It should be this Sunday,
Okay.
yes.
All right, and then I will have Trellis or I will reach out to you, and we could do a one-on-one about the matching before you begin. So if that's 9th, we got to meet
now,
tomorrow.
This is also another thing I wanted to ask Deanna. I mean, if we still kind of have to go over that, and I still actually have a couple of recruits that I still have left. I haven't met my requirement on the recruits. I had a few people back out on me. But I was going to see if it would be ideal for me to move it back 1 week and then start then. That way we can get all that handled.
If you think that you could have a better outcome, and maybe you could probably take Alejandro's advice if it will be helpful to do a orientation on March 9th. You will have some surveys to administer, but if you want to move it back a week and you feel like you could get a better outcome, you would know best on if that's possible between you and Diana, for sure. Yeah.
So how many people you estimate that you would have for March 9? Because
I'm counting on, hopefully, now that I have already have agreed to and said they would come, I have 9. I had a few more than that, but
okay. So
moved, so.
Because Time for Life doesn't include parents, so as
right.
protecting you and protecting me for Region 1, it doesn't include parents. It's only the children or the youth. So I believe that 9 is a good number, even though we are pitching for 15. A good suggestion would be that you meet with them and then you have this orientation with them and do the survey.
Okay.
Do you
Just
think
have the orientation with like the parents, you mean, and the kids all together?
Mm-hmm. You can do that, yes.
And separate the kids in a moment, because it won't be helpful for the kids to answer the survey in front of their parents. It would be better to be alone. I mean, you can move the parents to another a corner in the place that you are going to be, or you can ask them to be out of the room for 10 minutes, because this is anonymous, and the questions are really, I mean, some questions are hard. Some questions are really hard. So, and you have to be clear with the students.
You don't want, the issue is that you don't want the parents with the children answering the survey. We don't want the parents to even know what the questions are specifically, because we want the children to be sincere. Let's say, for example, if one of the questions is if they have drank alcohol, if the parent is next to them, they maybe will say no, and then the truth is that yes. So if it's okay for the parents to be there, but you don't want them at the time of them answering the survey to be, sitting next to them or something.
And also you have to be really clear with the students that this is anonymous, that
Confidential.
You won't share this information with their parents or nobody else. This goes immediately to the state in a sealed envelope. So.
All right.
Okay. So Elliot, Trellis will
I wouldn't necessarily be a minute. Go ahead. I'm sorry.
Oh, I'm sorry, Elliot. I was saying that Trellis will reach out to you tomorrow, and or by this evening, and we will schedule a time tomorrow so we could go over how to administer those surveys with the matching. If you do the orientation on March 9th.
Okay.
Is Belen on the call? Belen? Hello, Belen?
Maybe she's not there because Region 5.
I'm here.
I'm sorry.
Belen is Belen in the call?
Yes.
Okay. That goes for her too because it's only to the children. When is your start date? I'm sorry. When is
the 15th, Saturday.
Okay, so we have a little bit of time for Belen. But certainly for Elliot, it has to be like you said, tomorrow or something. Thank you very much. Thank you. Thank you.
Can you mute your line? We still hear background noise. I'm sorry. Thank you so much. Sorry about that. Okay, so moving on, we'll make sure that each region gets those surveys. And again, when you're about to implement, just email Diana, and we'll get in touch with you and make sure we schedule an orientation with you and that you have the tools you need for your pretest to administer the pretest. So the purpose of all of the community survey and doing the pre-post test is to answer the question of to what extent did the strategy achieve its intended outcomes. And again, that's us actually taking the indicators and the measures that lead to knowledge increase, attitude changes, and behavior changes. So that's what we will be reporting out. And additionally, with the matching, we get to see how did the biggest change occur with participants who did all 3 sessions, and were there adverse or negative effects to the outcomes? So that gives us more details and adds to the credibility of your program and your efforts. So now we're going to move on to environmental strategies. And again, like these are sticker shock, your positive social norms, your positive community norms, like the Most of Us campaign. And with Region 5, it's the only region that's doing compliance checks. So again, with Region 5, we could meet one-on-one. I will go over it very briefly, but we can meet one-on-one on how to administer those tools for that environmental strategy. The goal here, and I just want to keep you guys at ease, environmental strategies are very hard to track to show that there was an outcome. For instance, if you have a poster in the lobby, like what Region 5 was discussing, if you have a poster in a clinic lobby, it's hard to say, did this poster save a life? Or did this poster allow this parent to establish barriers in their home and hide alcohol? There's no way we could find that information. So the way how the state agrees, and I'm so happy that they do, the way they agree to measure environmental strategies is to keep track of the processes and the intentions and how you guys implement and share and disseminate information. So that's what I want to stress again what Diana said earlier, is that keeping track of the numbers and the exposures to these surveys are very important. And I will go through some of the tools that are in each of your appendices on how to monitor and track the exposure of those products that you are marketing collateral that you guys will be developing. So first I want to talk about sticker shock. This is one of my favorite environmental strategies, and there are two data collection tools that we will be using to measure sticker shock. The first one is the merchant survey. This is something that actually Alejandro brought to my attention. And what the merchant survey is shown up top in the white piece of paper. It measures the merchant satisfaction with the sticker shock event and whether or not they will do it again and what was their overall idea or based on them being there all the time, what do their customers have to say about it. And it also gives us an idea of the collaboration efforts of the merchant or the alcohol retailer. In terms of, are they willing to help CETPA with their efforts? Do they think underage drinking is a problem? And are they cooperative? This collaboration effort gives you an idea of the community's readiness to change and whether or not they acknowledge it's an issue and if they will help. And we find that if there are more people that are willing to help, then there are it gives you an indicator to the sustainability of the program and whether or not sticker shock could be implemented in other regions or more widespread in that particular community. The other tracking system that we use for sticker shock, which is the media tracking sheet can do it, but we could develop a specific one for sticker shock. It's basically a tracking sheet that tracks where the sticker shock event occurs. We want to make sure that you are implementing it in retail regions that have access to your population, especially when we're talking about Hispanic and Latino youth. It also tracks the number of stickers disseminated at each event. So we want to make sure that you're equally distributing the stickers. You don't want like 2,000 stickers at one location. Maybe you want to disperse it across 3 or 4 locations. And also what we would like you to do, if it's possible, 1 to 2 weeks after each event, if you could revisit the store and see how many stickers are left on the beverages, boxes, or bottles where the stickers are placed. But that gives us an idea of the rate at which the alcohol beverages are being sold that have the stickers, like how many people are being exposed to this in 1 week. And the example I have here to the lower right, this is what CETPA did 2 years ago. They did sticker shock at 3 locations, and at the first location, they disseminated 179 stickers, and after 1 week, there were only 23 stickers remaining. So that was a good event. Okay. The next one, I've noticed that some people are doing pledge cards. I haven't read this in the strategic plan per se, but I see that this is something that people are doing, where they're asking parents and youth not to share, or parents not to give alcohol to minors and minors not to drink alcohol. One thing I ask if you are designing pledge cards and using it is that you capture the zip code of the residents on each pledge card. So where they put their little signature that they promised not to do this, if they could have another line on the pledge card where they put their resident's zip code. What this does for me, if you look on the right, it gives me an idea of how you're implementing your program and if you're implementing in your region and your area. So this is, again, what happened 2 years ago when they did pledge cards. You can see that majority of the dots are concentrated around the DeKalb Gwinnett line, but there are in areas where there are heavy Latino, Hispanic population.
Nay?
Yes.
Just to let you know, well, all the rest of the people, that we are in Region 3, we are going to try to have pledge cards, but it's going to depend in the budget. If we have extra money, or we can cut expenses in another strategy in order to print these pledges. So we are not sure right now if we are going to do that at the end. We already work with and we create the pledge, the message of, in this moment. But like I told before, we need to talk with the financial department to see if we are going to have money to print the pledges. This is one thing. And on the other hand, I want to go back a little bit about the sticker shock campaign and ask you something. The merchant survey, do you want, or can we conduct the survey directly with the owner or the manager? I mean, can I ask the question to them, and or do you prefer that I leave the survey with them and come back later to pick it up? I don't know what is the
Great
best way
question.
to do it.
That's an awesome question. Thank you for that one, Alejandro. I will leave that up to you in terms of what you think will be best, depending on the relationship that you have with the manager or the general store manager. Ideally, if it seems to be better for you to do it like in an interview style, like if you want to call them up a few weeks after and say, hey, you know, why did you choose to do it? Did you enjoy it? Things like that. Would you do it again? You could do it over the phone and just take notes and send it to me, or you could leave it with them if you feel like they would respond to it or write it. I'll leave it up to you in terms of which way and how you choose to capture that information. I wouldn't mind if you asked it and wrote the answers in a note-taking style.
Okay. Okay. Another thing, I took this survey from the MAD model, and I just copy and paste. But I attend another CETPA for another provider here in Region 3, and they are thinking to change some questions to be easier. And also, for example, question 2 that say, why did you choose to participate in the sticker shock campaign? And they are thinking to have like a multiple answers, like a multiple choices answer. You know what I'm saying?
Gotcha. Yeah.
Just to be like just to have like a easier tool for the owners, because you know sometimes they just have a couple of minutes. I mean, in their schedule of the things that they are doing to attend that. So I don't know. What do you think? Can we modify that, or in order to be, what is the word? Like to follow the model, it's better to keep it like this.
Well, two things. It depends on how you administer it. If the regions that are implementing sticker shock prefer to collect this information using an interview style, I will keep the question as is, because it will be hard to read out multiple choice over the phone or in person when an individual could look at it. But if you choose to give it to the owner or the manager and have them complete it as if it were a survey, then multiple choice would be the best option. So I guess I could ask the regions that are implementing sticker shock, how do you think this will be the best way to administer this tool? Interview style or by survey?
Like I said before, and like you said before, I think that it's going to depend on the relationship that we have with the owner. Because if they are really open and they stay with us during the sticker shock campaign or something like that, we can do it in an interview. But if they, because I remember when I did this before with Kaeli, some of the owners, they just say, yeah, go to the place or go to the store. I won't be there, but you can do it. So that means that they don't have the time to be with us. So in that case, it will be better to left the survey with an employee or something like that and ask it to answer it and come back later to pick it up.
Right, right.
And,
so if you want, Alejandro, we could do it both ways, and I could leave it up to the coordinator's discretion about which one they want to administer.
Okay.
Okay. So I will take note of that, and we can make those revisions to make it easier for which one you choose to do. Okay. So the next one I'm combining together, and that's the positive social norms and the positive community norms. The way how we're going to track this information is using the media campaign tracking sheet. Every region should have this in their appendix, and I think it should be Appendix C2. And basically what this is doing is kind of like what Diana and I were stressing earlier about how much of each information, flyers, posters are you sharing with your partners. If you're putting a flyer in a clinic, we ask that you write the clinic's name, the date that you put the flyers there, how many adult flyers or youth flyers did you add, what's the city and zip code of the agency that you are posting this flyer at, And also ask, like, what's the age group going into this clinic? Are they mainly a youth or are they mainly adults? And are they of Hispanic or Latino origin? So this tracking sheet is, if it's not in the MPR, this is data that we definitely need to show that you are purposefully, thoughtfully, and intentionally disseminating information accurately, if that makes sense. Any questions about this handout? And again, I will work with Diana and Trellis, and we'll figure out what's the best way we could get this information from you guys, because we don't want to overload you, especially since you're doing your, you have your MPRs.
Ms. Bryan. Oh.
Yes.
I just have one question. Do you have the information that we have been spreading from before? Like, for instance, for the SFP, when we decided that we were going to do that and we started doing the recruiting, do you want us to put the specific events that we did, or only the agencies that we left flyers at?
So you're saying when you did the recruiting, you handed out individual surveys to people? Not surveys, but information
flyers.
Of the
event. Oh, so this is just for surveys then?
No, this is
No, I'm sorry. This is for flyers. This is for
okay.
flyers. This is like if you leave a stack of 50 flyers at a local park.
Okay, perfect. Thank you.
Now, Sinead, the only thing that I would like to say that at least in Region 3, I don't know. No, I don't know. I know. According to our plan, we won't have a message or a handout like a flyer or posters. We won't have those for this implementation year. This year, we are just to create the message. Hello? Hello?
Hola.
Hi, everyone. This is Charlotte. Shanae may have actually accidentally disconnected. We'll give her.
Trellis?
Yeah, I'm still here.
Oh, okay. What do you want to us to do in this moment?
Can we just hang on 1 second, because I'm not quite sure what just happened, actually. I'm trying to look to see if she is still on.
Hi, guys. This is Tara. Shanae got disconnected. Is everyone still on?
Yes.
Yes.
Welcome to GoToMeeting. There are 8 other callers on the call.
Say you had a question in the meantime. I think she's back on now.
Oh, no, Tara, give me 1 second. I want to call in through my phone. Right now I'm on my computer and I understand that it echoes. Just to call in and let you guys know I'm having technical difficulties, and I'll be on in 2 minutes.
Okay, go ahead.
Welcome to GoToMeeting. There are 8 other callers on the call.
Yes. This is just for the other 2, right?
I'm sorry, Gita. This is nothing with what?
This media campaign tracking sheet, the positive social norms and positive community norms, has to do with most of us, for me, and for parents who host Lose the Most, correct?
Oh, no. This is just for positive community norms, and I guess that will be the same for Belen, that she has the positive community norms, but in a different model. We have the most of us, and I think that Belen has a different model, but it's positive community norms as well. I don't know what is Elliot and
No, I understand, but we are not filling this out with flyers that we did for SFP, just for the positive culture. Okay, thank you.
No, this is just for positive social norms, and this is for the strategy, the media campaign strategy or something like that.
Yes. Okay, thank you.
I guess even though, Gila, that if you have or we have flyers, or we create flyers in a different strategy or something like that. Even though we can use this kind of example or this kind of sheet like an example, because we can add that to the evaluation report at the end as well. But just like an extra thing, you know?
Okay.
That's like Diana said at the beginning, that we are doing. We have a poster, we have already a banner that we are using, and we add to our strategies. For example, let's say that the Strengthening Family Programs, you bring the banner and you bring extra flyers that we have, like at the flyers that we created last year, and we use those. So we can add that in a different sheet, like I say, you know, we also brought this and this and this, and the families were or received this flyer, something like that.
Okay.
Very different.
Okay.
Sorry, guys. I'm back now.
Hello.
Hey, sorry about that. Okay. We're almost wrapping up to the end, and then we can have an open discussion about what you guys think about the training and if you had any other questions. So the last environmental strategy is Region 5 only, and I'll be happy to meet with you guys one-on-one so we could discuss how to capture this. But this is the compliance check, and we have two tools developed for the compliance check, and that is these tools were developed by GAS, and it has to do with alcohol promotion and retail availability tool. These are the two tools that we'll be using. And basically, it's going into multiple establishments and seeing the ease at which people could purchase or youth could purchase alcohol, and also doing environmental scans around the neighborhoods and communities to see how alcohol is being promoted in the region. So all these environmental strategies, data tools that we just went over will help us answer our two process evaluation questions about the extent at which the strategy was being implemented and what are the strengths and weaknesses of each strategy. The idea here, especially for the strengths and weaknesses, when it comes for information dissemination, we truly value personnel. We value the time that it takes to do these things, and also the money and the resources that goes into producing these things. So we want to know what is the most efficient process that we could, or the efficient strategy that we could use to get the biggest bang for our buck in terms of saving lives and reducing alcoholism among the youth. So examples of these findings would be like the reach of the strategies, like by doing a billboard, hundreds of thousands of people were exposed to it, and also the collaboration among your partners. We find that if more partners are involved in our strategies, it also it leads to greater impact in the community, and also it gives sustainability to the program. So for instance, the more high schools or middle schools that are involved in strengthening family programs, the more credibility it gives to that program, and the more likely that other schools and those schools will continue to implement those programs. And again, the way how we could track that is with the Allies Matrix worksheet. This is Appendix C3 in each of your evaluation plans. And this does not need to be conducted monthly. In fact, I'm thinking about just doing this at the very end, right before we have to do the evaluation report. And it basically tracks all the partnerships that you have used throughout your strategies, and how these partners help you implement your strategy, whether they provided access, like for instance, working with the middle school, that type of partnership gave you access to your population. So that's a key partnership in order to execute the strategy effectively. So these are the types of alignments or allies that we're trying to track. And the last one, you guys don't have to do this, but this is something that the evaluation team does internally, and this is the Fidelity Assessment Rubric. So this is us basically comparing what you plan to do in your strategic and implementation plans, and if you guys did it, if you reached your target audience, like if you're creating a message for your positive social norms campaign, Did you test that message? Was the message received by the community? What were the media outlets that you used to give this message out? Like, was your process thoughtful? And what this will end up giving us is a score on a scale of 0 to 3, and 3 being high fidelity and 0 being no fidelity at all. And I noticed if you look at the fidelity matrix in your evaluation plans, not all activities are applicable to your program, and they will not be counted or included in the fidelity scoring. And this is a strategy reach worksheet. This is an example of how it was completed. So basically for each of the strategies that you're doing, we're asking that you give us an account of the participants and the population and where, how did you actually reach them. This worksheet right here will help us complete the fidelity matrix or the fidelity assessment scoring that was previously shown in the slide above. And again, we will most likely do this one time right before we do the evaluation reporting. So again, those fidelity tools that we just mentioned will just help us figure out the strengths and weaknesses of each one and of each strategy, and also whether or not the strategy was implemented as expected. So the point of me sharing these tools is to let you know that each one of them is important when it comes to doing the final evaluation report. And lastly, we will go over the last tool. Has to do with coalition functioning and community mobilization. So what we'll do, like for each of your CETPA members and each of your internal coalitions for each of the regions, we will administer a survey electronically. So basically, I believe how it will work is we will email a survey link to each of the program coordinators, and you could share these links with your strategic partners and your coalition members within each of your regions. And basically what this survey is already programmed in SurveyMonkey, but this survey gives you an idea of how the coalition and the group are forming, the level of agreement and consensus within the group. And it also makes sure that your strategies and how they're being implemented are also done thoughtfully and with the community in mind. And this survey doesn't take but maybe 5 minutes to complete. And when I share this link with you guys at the end of the year, it will be, I will include like introductory survey language and explain what the tool is about, so you could just forward the information to your coalition members. Any questions? Okay. And the last tool that will be administered is the community readiness assessment. I know you guys are familiar with this because you had to do it for your needs assessment planning. And how we report out, and we find this to be very informative, especially with reporting to the state, is by dimension. So we based on the key informant interviews, and you guys all know what the protocol looks like, we would assess it and score it. What you guys did for the baseline assessment, we will now do it for the post-assessment, and we will compare how did the community readiness change overall and across each of the dimensions. And this is something that the state is greatly interested in. And this comes from key informant interviews of the community members. Any questions? Okay. All the data, all the coalition data tools, the online survey that I just discussed and the community readiness score, all of this will help us answer the last process evaluation question about to what extent did the community readiness change in comparison to the baseline. All right. So in terms of evaluation, communication, and reporting, there are 3 types of reports that is written in our contract that we will do with CETPA and across all the regions. With the permission of Diana and Dr. Mancini, we can do individual strategy reports. So for instance, Alejandro is doing his Rockbridge Middle School Strengthening Families Program strategy. If he wanted an individual report for that specific session that he implemented, we could do that for him. But we have to get the permission of Diana and Dr. Mancini before we could do so. And we're only doing that for individual strategies. The other reports that we could do are interim evaluation reports, and again, that's assisting with any required reporting of the regional programmatic activities. And this will be either requested from CETPA executive team, Diana and Dr. Mancini again, or by the state. If the state comes to us and CETPA and asks that, hey, we want to know how this is going, can you do a report for us? Eval group will do that. And what's in our final type of reporting and communication would be the final evaluation report. And similar to how each region has their own evaluation plans, you will have a final evaluation report for each region describing how each of your strategies were implemented, the impact of them, and all those 4 evaluation questions that we went over, the 3 process and the 1 outcome, will be answered for each region. Those evaluation reports will be submitted to the state and the University of Georgia, because they're the state evaluators, and the CETPA executive team. Just like what we did with the evaluation plan, each region will get an opportunity to review their final evaluation reports before they're submitted. We think that's just fair. And at the very end, the state may require the local evaluators to give a presentation to the other GASP-funded agencies and the other regional local evaluators. And this is where we share common issues that we may have, like with the community survey, and I could discuss how it's not really user-friendly in the Hispanic population. This is where all that discussion happens. And the state will also ask us, how could they improve their program? And this is where we give our feedback as well at the end. All right, so that concludes our training, and I would like to open up for any additional comments. I know that we had some questions and comments throughout the presentation, but if there were any closing questions or closing comments that any of the regions had, or Diana, this is the time.
This is Region 5. I want to just say thank you so much. It was so clear and understanding for me, and this is going to help me a lot. Thank you.
Oh, awesome. Thank you. I'm glad it was helpful.
Oh, thank you so much, Sinead Antrelles. Unfortunately, Diana is out of the room right now because she's talking with Dr. Mancini. But I'm gonna let her know the last couple of slides, and if one of you, some of you have a question for her, I think that the best thing is to go write an email to her on Monse, and she will be able to answer it as soon as possible. Even you, Sinead Antrelles. And okay. In my case, I would like to ask Sinead Antrelles if it's possible to have a meeting with you, maybe with Trelles, to talk specifically about positive community norms, because I am behind, in Region 3, we are behind our schedule for some reason, including the snow, all the stuff. But I would like to ask you if we can have a meeting with you to talk about it.
Sure. We could definitely schedule that offline. Trellis will most likely coordinate that. And I also noted that, again, we'll meet with Region 4 with Elliot as well. So, yeah, we could do that, definitely.
Perfect. Thank you so much.
From Region 6, I just wanted to say thank you, because I had a meeting with my RPS, and they were asking me why I had so many empty pages on my evaluation, and I started working on them, and I had no idea what to do with page 23 and 43, so you cleared that up, so thank you.
Sure, no problem.
So when is it that you want to meet up again, or schedule another?
Elliot, Trellis will email you immediately after this session, and we could begin brainstorming times for tomorrow. I guess it would have to be either this afternoon or tomorrow before March 9th.
Okay.
So you're definitely a priority in making sure you get those tools for the beginning of your program. Yeah.
Okay. Yeah. If it could be anytime tomorrow afternoon, that would be great.
Okay. That actually works with my schedule as well.
Alrighty.
This is Trellis. Absolutely. I plan to follow up with Shanae, specifically Elliot with you as well, and Alejandro schedule a separate meeting. With those of you, please, I know this is, you're thinking a lot and you're kind of, we've done a lot in 2 hours, but please, please feel free, and I'll reiterate what Alejandro says, like if you have questions or you think of things, we are always open to emails to clarify or if there's any kind of follow-up. I have definitely taken notes for a couple of action items that we have, but please don't forget our door is always open for you.
Thank you.
And lastly, with our closing email, we will email the final slides in PDF for you guys. And also, this meeting and this webinar is actually recorded with all of our technical difficulties. But it's recorded, and we will share the link to that so you are able to watch it if you ever needed a refresher course, or if you ever have like a new team member or assistant that could, just use a little booster on what's the purpose of things. So it will be a useful archived resource for you.
Okay.
All right. Well, I hope everyone has a great afternoon. And again, if you have any questions, email us and we'll be in touch.
Thank you.
Thank you. Bye, everyone.
Bye.
Bye.